Ghana is beginning to witness a surge in COVID-19 cases. This has been attributed to people not adhering to COVID-19 safety protocols, especially during the festive season.
The Xmas and the New Year activities, people were not disciplined enough. You could see that there was no adherence to the protocols, no use of face mask, and clearly this disease is a disease about closeness. So if you are not adhering to the protocols and you are so close, then you are going to share the infection.
What we had in 2020 was COVID 101. The 2021 COVID is proper COVID, and that's where most people are quite sick.
I'm back here at the Ga East Municipal Hospital. Here, hospital beds were filled with patients, some struggling to breathe. Zion Sonu, not his real name, narrates how a simple social gathering during the Christmas festivities led him to the treatment center. How did you contract COVID-19?
A friend of mine contracted it, and we had no idea he got it. So that's how I picked it up from him. We had a small get-together, and that's how we got in close contact without enough social distancing, and that happened.
Was it during the festive season?
Yes, during the festive season. Well, it's real. I lost my friend. He passed away. I'm lucky to be here. It's very important that the COVID message is continued.
As at January 12, 59 people were on admission at the treatment center. There were 4 severe to critical cases and 12 patients at the high dependency unit of the hospital. 23 patients were on severe to moderate to high flow oxygen at the emergency room. The emergency room can accommodate 12 patients, but the hospital had to expand to accommodate the numbers. Ghana is currently recording a surge in COVID-19 cases. At the Ga East Municipal Hospital, we have close to 60 persons who have contracted COVID-19. Now, persons who have contracted COVID-19 have a simple message to Ghanaians that we must strictly adhere to the COVID-19 safety protocols.
Those in the HDU, high dependency unit, and the emergency room, they are all community cases. If you know about the President's directive, those coming from the airports are brought here. But they usually have mild disease or they are asymptomatic, and they occupy the recovery area. But because we move them out, they are not a lot. So I would say about 70 to 80% of our patients are coming from the community. And yes, we've seen a significant rise. We're doing an average of about 3 new patients a day, 2-3 new patients a day over the past 2 months. But since 4th January, we are doing almost 10 new patients a day for inpatients alone. There are times we even see more, but then we manage them on outpatient basis and we let them go back home for home care. But we are seeing a lot more of ill patients now than we used to in the past.
The hospital is augmenting its staff strength to deal with the increase in new infections.
A number of patients we've had to ask not to come in because we are limited. It's not limited by bed space because yes, this is a 100-bed hospital. We can take 100 patients, but we are limited by human personnel, so it's a capacity issue. A lot is being done. We have about 27 new nurses who were brought in just yesterday to augment our strength. We are expecting about 7 new doctors to be brought in. 2 arrived today. We expect more to come in before the week ends.
The situation was not different at the Greater Accra Regional Hospital.
In Regions, we have 8-bed capacity for COVID-positive patients. As we speak now, we have 5 patients who are severe to critical cases here. They are all on oxygen. Since we opened our ICU in October, we have been having a lot of patients here. In November alone, the 8 beds are almost full. We are getting more critical cases or severe cases being referred to Regional Hospital, because it's a designated area for COVID ICU.
So far from March till now, we've had about 36 deaths in Ridge Hospital alone, March last year to date. We are having more severe cases coming in to the hospital. And so the advice is to maintain the COVID-19 protocols. I think we have relaxed on the protocols, the safety protocols.
Healthcare workers and persons who have contracted COVID-19 want the public to wear their face mask and strictly adhere to the safety protocols as the numbers are now turning to people closer to us. Portia Gabo, TV3 News, Accra.